Today is a special episode of the podcast because I'm joined by Zach Holdsworth of Hint. And I am so excited to announce that for the listeners who might not know, the Hint Summit is coming up at the end of October. So, Zach, thank you so much for joining us today.
Thank you for having me.
So, Zach, for the listeners who don't know what Hint is, can you tell us a little bit about Hint to start?
Absolutely, yeah. So we started Hint about eight years ago, and with a vision really to support the growth and success of the direct primary care movement. I guess our core thesis was that a big part of the reason the healthcare system's broken is because of the insurance fee-for-service system and the kind of the broken business models in healthcare. And so we wanted to support a community of doctors and healthcare providers that were stepping outside that system and really recreating it from first principles. And so have been really passionate about supporting the DPC community since then. And so in terms of what we actually do, we're a technology company and we have basically a billing, membership management and billing system, as well as our platform helps support direct primary care groups that are working with them, self-funded with employers as well. So our platform handles the enrollment, eligibility and billing for both retail membership management as well as the employer direct contracting. And then, we integrate with a bunch of really great systems and really focused on supporting this community. So that's a bit about what we do. We started Hint Summit really to help accelerate the movement and bring our community together in a way that we thought could be really positive.
Amazing. And acceleration is a good word to represent the Hint Summit. Maybe it's because it was my first summit that I ever went to in the DPC ecosystem, but it is my favorite summit because it's not only focusing on where we are as a movement, but it's focused on where we can go in the future, which I absolutely love. And so I definitely would say I'm super biased and go sign up today. But so Zach, historically, you've had these amazing speakers, and already as of today, when we're recording this episode, you guys have released tickets as well as the start of the list of speakers. So can you tell us first, when is the Hint Summit going to be and where is it going to be hosted?
So it's going to be on the 28th and 29th of October. We're going to be hosting it virtually online. We're hoping to get back to in-person this year, but figured that I don't think that we're quite ready for that just yet. So we figured we'll keep it Hint Summit 2D, and you can learn more at summit.hint.com. Yeah, and it's going to be online, and we've got some pretty cool technology to help make it more interactive and make sure people can connect while also keeping it online. So
awesome. And you guys are on the Hopin platform again this year?
That's right. Yep.
Yeah.
We trialed that out last year and we found it was great. So we figured we'd give it another shot this year.
Wonderful. And one of my favorite features last year was the speed networking. So will that be brought back this year?
Yeah, for sure. We're going to be doing the speed dating or speed networking. And we're also with Summit, it's with the in-person events, it's a lot easier, I think, to come up with creative, exciting things to keep it fresh and make sure that it's, more than just a conference, right? Our vision ever since we started in Summit is we really want to make an experience that people would almost want to go to, even if they weren't a DPC doctor. So we try to bring speakers from outside the movement. We try to have, fun parties and interactive sessions and things like that. But when it's virtual, you're a little bit more constrained, but in other ways, you're actually less constrained. For example, the speed networking it's really hard to do when you're physically there. So that we'll definitely be bringing that back. And also, we actually just came out of a brainstorming session with the team yesterday. We were thinking of other creative ways to form connections and ensure that it's exciting and entertaining as well as educational.
I'm excited to see what you guys have up your sleeves. This is awesome. For the people who weren't in attendance last year, when the speed networking happened, everybody got randomly paired with another person who was an attendee at the Hint Summit. And then every 3 minutes, I think it was last year, you would have 3 minutes to talk with this person and then share information, and you could connect with them after if you wanted to. But it was so exciting because it was the chance to really meet a person, even though it was virtual, on a one-to-one basis, where that's what we all miss about being in person. So it's a way to do that with what we have in front of us, the virtual experience.
Yeah. And actually what's interesting about when you're in person, typically you'll meet someone, but then I don't want to say you get stuck with them, but it can be hard to meet someone else because you have a really long dialogue with that person. So when it's virtual, you're able to create the serendipity that you have with in person, but also make sure you get to meet a lot of people. So I think last year there was more than 1,000 connections made or something like that, which is pretty cool.
With regards to the panel of speakers, now you talked about historically what you've had in terms of speakers who are beyond the DPC movement in terms of people who are not just DPC doctors. So can you tell us what we can expect so far at this year's HINT Summit?
We haven't finalized the list yet, and there's still an opportunity if there's interest in submitting a speaker submission as well. I'd say maybe the high level thesis with when we start to think about thesis is we don't want to stay just in our echo chamber, right? Like it's important to have insights from within the community, but also to constantly push the boundaries of trying to bring in other perspectives and views from outside the DPC community and to expand our thinking within healthcare. But also one of the things we try to do is bring in fresh perspectives outside of healthcare to cross-pollinate ideas. So but in terms of just a few of the folks that have been announced, we're going to be having Senator Bill Frist, who's the co-chair of the Health Project and at the Bipartisan Policy Centre. We've got Marshall Allen, who's an investigative reporter, and was actually a Pulitzer Prize finalist. So it's going to be really interesting to hear their perspective and what they have to say. We've got some clients going to be there. One of them that's been announced is Delicia Haynes, who's a really amazing story, and we're going to be hearing from her. And another interesting speaker we have is Ernie Clevenger, who's the co-founder and CEO of Care Here, which is not necessarily a DPC group, but as he was a founder of essentially a near-site on-site clinic, which shares some similarities with DPC. And so we're going to be hearing from his perspective on working with employers. And we've also got Stacey Richter lined up, and she's the host of the Relentless Health Value podcast. And then also Jay Keese, he's a common attendance, but he'll be there giving us an update on what's going on from a regulatory perspective. We've also got Dr. Paul Thomas, who's going to be helping with some of our DPC Accelerator content and work streams, along with Laurentine Creddy. So we're going to be breaking the day into the sessions to a couple of different days. One of them is going to be a little bit more focused on kind of vision and big thinking and how can we transform healthcare and really push the direct care movement forward. But another day is going to be a little bit more tactical about just education and how can really become successful as a practitioner within direct primary care and direct care models. And so they're going to be leading that. And another interesting, just a side note, is we're actually going to have the HINT Health head of IT security spending some time actually talking about security, which is a big topic in healthcare right now. It's not really DPC related, but we're going to bring some of those insights as well. And as always, you'll get to hear me, and there's going to be a bunch of other speakers as well, which we're finalized right now. But it's looking great. It's always a little bit fluid how it all comes together, but generally speaking, it's a really great product at the end of the day because we're really passionate about it and want to make it an awesome event.
I would love if you could share who is the right audience to come to this conference, because for residents and medical students, it's actually free for them to attend.
Yeah, one way I tend to think about the direct care movement is that we're really trying to transform the healthcare system. Okay, and so at the end of the day, HINT Summit is about trying to help that conversation. So we start sort of really big picture. And in that respect, we're bringing a bunch of folks in that are obviously direct primary care doctors and practitioners, but also the sort of administrative teams or business teams that are supporting them. So there's relevant content and connections there, but also other groups that are building, let's say, networks or looking at innovative health plans that are wanting to integrate direct primary care type models in a way that's authentic, or brokers or benefit advisors that are trying to change things from their angle as well and want to try to integrate these types of really powerful models into their plans with employers. It's also for, I'd say, employer groups or HR teams that want to learn from this community on ways that they can actually impact the lives of their employees and reduce costs in a way that's actually pushing everyone forward in the right direction. So I'd say at a high level, it's people that are interested in transforming healthcare and see direct primary care and the direct care models as a potential way to achieve that. And so that's how I'd think about it. But it's fairly broad, and I'd say it tends to be about a third kind of doctors and practitioners and their teams, and a third sort of people that are wanting to integrate, building direct primary care networks, wanting to integrate direct care into what they're trying to achieve. And then there's maybe I'm probably getting the ratios wrong, but there's just a third of people that are just interested in transforming healthcare.
Absolutely. And that goes back to the speed networking. You never know who you're going to meet. And I remember the people that I met through speed networking last year, some were people already that I knew from the DBC community, but then I met medical students, I met brokers. And so it's really exciting that this is a summit where everybody is coming together. And Shane Purcell's episode just came out last Sunday. And this idea of integrating with employers and being able to see avenues where we can push the movement forward through working with people we never thought that we might be working with in the future. What I loved about the Hint Summit was that you don't even know if you're going to use the information, but you just, well, like any summit, absorb as much as you can, plant it in the back of your head, and then you might use it later. It might become very valuable when you're talking with somebody about your practice later on.
Yeah, it's interesting. I actually was just off a call with a friend a few weeks ago who had mentioned that the last Hint Summit was actually that they met the most significant business relationship that they've had in the last 3 or 4 years. They actually met at the Hint Summit, and it's hard to predict that. So I think really anywhere from people getting started, or even as you mentioned, residents or students that see the light at the end of the tunnel in terms of maybe the healthcare system could be amazing a place to work, and in a way that's authentic to their, the reason they went to school in the first place, but also in a way that's going to be sustainable for their mental health and their passion for delivering healthcare in the long term. That's also a great place to come, because you're going to get the sense from the community. One of the things that's, what it's all about. One of the things I love about the Hint Summit is you sort of really get a feel for the sort of energy and the movement from this conference, because there's so much passion and there's so much excitement, there's so much shared kind of vision. This is a great place to kind of absorb that, right, as anyone.
And how much does it cost to attend the Hint Summit?
So I think the early bird tickets may have just finished up, or if not, it will be soon. But the general public it's $199. We have a bit of a discount for Hint customers, so it's $99 for Hint clients, free for students and residents. But yeah, we try to keep it affordable. And one thing I'll say, if there's someone that if cost is an issue, our goal with Summit isn't really, it's not a profit center for Hint, right? We see it as really a non-profit initiative for him. And so to the extent where cost is an issue, it shouldn't be the reason you can't come to Summit. We just really try to cover our costs and make sure we can get really amazing, inspirational people there and put on a bit of a show as well. So we have to charge something, but yeah, that's the high level in pricing.
And in terms of preparation for the summit, you guys are using Hopin. What should people be making sure they're checking tech-wise before they join the summit?
Yeah, it's pretty simple. You obviously register and get set up. You basically need to make sure you've got a microphone and a good internet connection and a video connection. Actually, the video connection is optional as well, right? If you don't need a video connection, but if you're in those speed dating things, it's nice to be able to connect with people. So yeah, otherwise, it's really just, if you can get on a Zoom, then you're probably able to get on into the conference.
Wonderful. And last year, Ariel was also in a joint meeting with Lauren talking about strategies that DPC doctors could use. And we had a little bit of a breakout session to work on strategy for our own clinics. And so I'm wondering, in terms of preparation for the Hint Summit, would you challenge somebody to look at their practice and ask themselves 2 or 3 questions to prepare themselves to attend the Hint Summit, like to reflect on the way that they're doing billing or the way that they're working with the idea of employers, anything like that you could throw out to challenge people who are going to be in attendance?
Yeah, I'd say one of the things we're going to be doing this year is leaning into the sort of accelerator component that you saw at last year's summit. And obviously Lauren will be leading that, but we're also bringing in Paul Thomas as well, who does a really great boot camp. And we're going to be providing a little bit more structured content around accelerating your business within direct care. And so I'd say, maybe just, I think your suggestion of just been reflecting on how you think your business is doing, areas you think you could improve, areas you'd want to potentially learn from others. Because for sure there'll be someone at Hint Summit that has achieved what your dream would be in terms of executing a better marketing plan, or being more efficient in terms of the way you're operating the clinic, or better ways to just operate your business across the board. There'll either be structured ways you'll learn that through the accelerated content we're bringing, or just unstructured, sort of serendipitous connection that will happen. Yeah, and so I think if you just come with an open mind, come with a desire to learn and improve, then I'm pretty sure you'll take at least something away that could be fairly game-changing for your business.
Awesome. And if a person is unable to attend, can they partake watching the recorded sessions, or how will information be accessible to people who want to attend but can't attend the actual virtual summit?
Yeah, so what I assume we're going to do is we'll take the content and essentially put it up in our content library, our video library. So you'll be able to go to summit.hint.com and see the content. It'll probably take a few weeks or so before it'll be live if we're going to do that. But yeah, I assume at least a good chunk of it will be made available. One thing that you miss out on that is you miss out on that interaction. You miss out on that ability to interact with people and ask questions and be sort of with people, because it does feel like you're actually at a conference. It's uncanny, to be honest.
It really does, though. I remember last year just seeing familiar faces, but also meeting those new people. It was that joy that we have in person conferences, where you get, for me at least, I get excited when I meet a new person. So I do agree with that statement completely.
And the other thing you miss out on is we're trying to curate it so that, not to say if you can't make it, then for sure watch the videos, but there's something to be said about the sort of curated experience. The content, we try to thread a narrative through the content so that it's connected, and that it's sort of, we're building on concepts throughout the event. Yeah, that's something else. It's a bit harder to then go and click through and look at everything. You miss that, and you miss that the sort of MC side of intros and things like that. But yeah, for sure, if you can't make it, then sign up to our newsletter or our blog. Just they can probably blog.hint.com and register, and we'll likely push out a notification to folks after Summit.
But for $199 is the maximum price, and $99 for Hint users and $0 for residents and medical students. That's pretty incredible for all of the experience that you get. That's just my own opinion, but I really feel that's a really good price point. Is there anything else that you wanted to include about the Hint Summit and what to expect and what to get excited about?
Yeah, don't think of Hint Summit as a conference. Think of it as an experience. And if you haven't been to Hint Summit, you're probably thinking, yeah, it's going to be like a conference. But I do believe the intention of Hint Summit is that it is a experience. It's fun, it's engaging, it's refreshing, it's inspiring. And that's what, if that sounds cool, then you should register for Hint Summit. Yeah, and we're going to have some interesting curveball people coming to speak as well, and there's going to be some interesting entertainment, and yeah, so hope to see you there. And also, one thing to note is that right now it's $199, but we're going to put the price up to $299 the last week, just to motivate people to get in early. So make sure you don't miss the window there.
Thank you, Zach, for joining us today.
My pleasure. Thanks for having me.
This Sunday, look forward to hearing from Dr. Laura Brasenio-Kinney of Leeton Medical in Leeton, Missouri. A reminder that Marketing Beaver is offering a special to My DPC Story listeners. In addition to the DPC marketing they do for as little as $3 a day, they will help you level up your marketing game through a pitch video special. And there is still time for those interested in both learning and strengthening their knowledge in point-of-care ultrasound to take advantage of the 10% off registration discount offered by Global Ultrasound Institute exclusively to My DPC Story listeners. The discount is for their live 2-day in-person event coming in October in San Francisco, California. Check out our website, mydpcstory.com, for more information and to check out these discounts. Also, there are still some incredible DPC Alliance masterminds coming up. Use the code MyDPCStory, one word, all caps, when you register at dpcalliance.org for $50 off registration. If you like what you heard today, please leave a review and subscribe wherever you listen to your podcasts. Tell your friends too. For more information on this episode and much more, including DPC swag, please visit mydpcstory.com. And for the latest in DPC news, check out dpcnews.com. Until Sunday, this is Marielle Concepcion.